I'm very thrilled today to be meeting with Diane Sargent, Director of Corporate Relations for the South Shore Elder Services. Good afternoon, Diane.
Yeah, good afternoon.
Very nice to be meeting with you today, and thank you.
And thank you for having me.
Could you tell us a little bit about South Shore Elder Services?
Yes, we're a private nonprofit organization, and we are primarily state-funded and federal dollars as well. But our home care program, the program that ties with our mission statement, is to try to keep seniors in their home for as long as it's safe to do so. So to that end, we provide a lot of in-home services to those elders. These are people who probably couldn't afford to purchase the services, so it's subsidized by the state. And it can be any number of things. We put in homemakers. In some cases, we send people to an adult day health or a social daycare, medical transportation, lifeline, the personal emergency response systems. So we design a service plan for each individual client that helps them remain in the home. We work with the family members. They provide what they can, and then we subsidize the services. We also try to coordinate with other agencies that might be in there, like a visiting nurse association or a skilled nursing component that's in there. Then we'll try to work it out so that we maximize the time that we're in there and not duplicate.
What is your community? Or where is it
We do
from?
the 11 South Shore area towns, and then there are 27 sister agencies across the state, and each one of us covers a different geographic area.
Okay. And you mentioned earlier about the state funding or federal funding. Can
Right.
you just elaborate a little
Right,
bit on
the
that?
state funding supports the home care system. That's the system that provides direct services. The federal dollars support grants that we give out to the community. We look for to provide seed money to services that are lacking in the community that would really benefit a senior. So we do focus groups, and we do them in different areas in our service area. We see what kind of services that are needed that maybe aren't plentiful enough or don't exist at all, and then we give out some federal dollars to that, to those persons to work on those issues. We also give a large grant, which is kind of a mandate, to Greater Boston Legal Services, and they will help our seniors advocate if their Medicare or Medicaid benefits are being disputed, if they're being evicted from their homes or their apartments. To
So they
seniors.
provide it to individual
Yes,
seniors as well.
they
Okay.
do, yeah. So we work with them. So that's the federal grants. We also deliver the home-delivered meals. We deliver over 1,300 meals a day to homebound elders. So we have a huge cadre of volunteers that we work with in order to get those meals delivered. We will be having an upcoming walk for Meals on Wheels, be over at the South Shore Plaza on November 22nd. So we'll be looking for people to walk and to get people to sponsor them in the walk. That's the way that we can keep that program running.
Is it within the plaza?
Yes,
The walk is?
it's
Oh,
inside
excellent.
the
Is
plaza,
weather
and it is a
cool?
Sunday morning, but we do it before the plaza opens up in the morning. So, and we have young people come too. They can get 4 hours of community service if they get a pledge of at least $25 from various sources, and they can come and walk, and then we'll sign their pledge slip for 4 hours of community service, and all the schools are requiring that now. It's nice to have the young people there, you know. And then
Absolutely.
groups will get together and walk, and individuals will walk.
What kind of challenges do you see?
Right now, because as you know, it's no news to anyone, the state is in bad shape. And because we are reliant on state funds, the majority, we do fundraising as well, but the majority of our money to support our seniors remaining in the community comes from the state. And we have had budget cuts. We don't know, they're talking about additional cuts coming down, but we are not positive about that yet. So it all will have an impact on servicing the clients. We do a big push for a fund that we call the Special Needs Fund, and every year that monies are getting used more and more. And this can help any senior in the community. It's more or less a one-time thing, But we help on anything. If they need food, if they need medicine, if they need a hearing aid. Now, we might not be able to buy all of that, but we can contribute to it if they couldn't afford to purchase something on their own. So it would be something that's not covered under their health care benefits, that they don't have enough money for, and maybe the family can't help them purchase this or get it. So we can, the money will go like directly to the purchase of a service or a good for that particular person.
And that's something where you look for private funds?
Yeah,
and
we look, that's all private
fundraising?
funding. That is not in any way state funded, and we keep none of that money. It's a pass-through. Every dollar we collect for that fund goes directly out to a program or service for that elder.
Okay, and if someone wanted to support to that, they could also call?
Oh, yeah, and called me directly on that when I usually keep that baby. I really, the way it's heartbreaking sometimes, some of the situations we see. You know, I think, I can think of one woman who, the homemaker agency had actually called us and said, we can't wash this woman's sheets one more time. They're just going to fall apart. They're very thin. She lives on a very limited income. So, of course, that would be something we could purchase. But the caseworker said to her, well, is there anything else that you could use? And she said, well, I hate to ask, but she said, I haven't had a new pair of shoes in 4 years. 4 years. And I'm looking at all the shoes in my closet. I'm about crying. I said, oh, 4 years, no shoes. And, you know, this is all she's asking for. So it can be something as small as sheets for the bed, or it can be something larger. We've bought special mattresses for a bed for someone, you know, who's got issues with pain or breakdown of the skin. So it can be anything. It can be we've helped homeless people move into an environment, and we work with community agencies on something like that. It wouldn't necessarily just be us.
So you do partner with quite a few?
Yeah, we do, yeah. Well. You know, Janet Labarge has been wonderful. She's, as you know, she does clean out. She'll keep good furniture, and we've used her to get pieces of furniture for people. She's helped people move, clean outs for some of the seniors that really needed help with that. So it's great to know all of our community partners that will work with us on those issues.
That's Janet of Dirty Deeds?
Janet, Dirty Deeds, done dirt cheap, and she's great, community partner, yeah. So, and there's many more, you know, many more people.
Now, I understand you're going to attend the nonprofit Toolbox event on October 22nd.
I am. I'm really excited about that. I looked at the curriculum, I said, oh, this is great, especially now that we're in more of a financial need than ever. I was looking at, you know, maybe I need to look at, I've done a few grants. It's not really, I'm not an expert at it, so I thought, oh, there's something I'd really like to do, go to the one on grant writing. The social media, I understand, is really key now, and so I'd like to really sharpen some skills on being able to do that, using the web more productively than I have or know how to do, so I'm really looking forward to that. And anything around fundraising to improve that, working with community partners to help us sponsor, you know, more revenue coming in here would really be something that so that's why I'm excited to go to that, and I think that will really help us.
Great. Well,
Yeah.
Is there anything else you'd like to share or tell us about?
No, I think we just, you know, I think what we do here, I think if you ask any senior, the majority of them, where do they want to stay? They want to stay in their home. They want to stay in their community. And so that is our goal, to keep people in their home, as long as we can do it safely. There are situations where people have to go to a nursing facility, but I think given their druthers, and if we can support it with the necessary services, that is our goal, and that's what we want to do. So I think it's really important that we are able to continue to do that.